here, Zoom recording from my home with Westford Health Director, Jeff Stevens. We're doing our weekly update. How you doing, Jeff?
Good today. How you doing, Patty?
I'm doing good. Beautiful day. Windows are open. Feels good.
Definitely
So,
nice.
yeah. So let's talk a little bit about what's going on with COVID-19, both in Massachusetts, Middlesex County, and in Westford. Can we talk some numbers?
Sure. Right now, we're a little over 17,000 cases in Middlesex County, and it's closing in on 18,000. But we're seeing a slow decline in positive cases and hospitalizations, which is good, at least in the region and the state. Locally, our numbers for positive cases are up to 131, and that number is always going to go up. Like we've talked about before, the amount of positive cases will always build. The amount of active cases, which currently is at 74, does happen to fluctuate here from time to time. As people get better and they recover, they come off of that list. And the amount of cases that are fully recovered at this time in town is 52, which is good. I'm hoping that in the next few days, we'll be able to take more of those cases off of the active and put them into the recovered category, but we can't move them until people feel better. So that's an important thing.
So recovered would be that they're tested again and they no longer have the virus in their system, or is it that they're better, feeling better?
So it's funny you should ask that question. There is a lot of discussion over what actually does recovered mean. And clinically, there are a lot of different definitions, and I still think it's up in the air. There are some people that say if you don't have a viral load anymore, you're recovered. Other people feel that if you don't have any symptoms and you feel fine, you're recovered. So I think there's still a discussion on what people consider recovered, but what we're using in town is if you feel better and you're no longer sick, we're taking you off of the active cases list and we're considering you recovered at this time. And we make sure that before anybody comes off, we know they feel better, we know they're 100%. And fortunately in Westford, a vast majority of our cases are people have had mild symptoms and they haven't had a very severe case. There have been severe cases in town, and there has been some presumptive fatalities with this. I believe there are 5 in town at this point, and there haven't been for some time. And we're hoping that number doesn't go any higher. That's one we don't want to change anymore. So that's where our current numbers are right now.
The people that have had the more severe symptoms, are they generally like we're hearing elderly, people with underlying conditions? Has anything surprised you?
So far, nothing has been extraordinarily surprising with what we have seen and heard. A vast majority of the serious cases are people that are people with underlying medical conditions and comorbidities that go with COVID-19. Many of the people that have been hospitalized were probably hospitalized for something else already or needed to be. And if COVID was the thing that made them a lot worse, then that's what sent them to the hospital.
I saw something about this secondary disease that some younger people are suffering from. It's a pediatric inflammatory syndrome.
Yes, this is fairly new information. It's been building over the past couple of weeks. It's called Pediatric Multisystem Inflammatory Syndrome, or PMIS, or some people are calling it PIMS. As of May 14th, there were 9 people in the state that have had it. There are none in Westford that I'm aware of yet. That's a good thing, and I hope it stays that way. And it's a fairly aggressive disease that is attacking people predominantly under the age of 21. And some of the symptoms are reflecting Kawasaki syndrome. Within that, it could be rashes, it could be cardiovascular changes, kidney injuries, and respiratory symptoms that may be prominent. And I can only tell parents, if you're starting to see a rash or you're seeing fevers that are after your kids have maybe tested positive for COVID, get in touch with your doctor right away and make sure that you're looking into this. I'm hoping that it's still considered a very rare disease. I think there's only a couple hundred cases in the country. I don't have an exact number, but there were 9 in Massachusetts, like I said. So it's here. So we just need to watch it for sure.
So this is a disease that occurs when someone has coronavirus. So it's directly related to coronavirus. You don't get this unless you have COVID-19.
Well, I think there's a lot of where I'm not a medical doctor. I can't tell you this specifically. I can only tell you what the advisories come in and say. This is something that they are linking to COVID-19 right now. So it is not necessarily because of COVID-19, but there seems to be a correlation, and it's now been made a reportable disease in the state. And anybody who sees this, they're doing a full reportable disease workup, which if any case goes into our virtual reporting system, the Maven system, our local public health department would know about it, and we'll hear about somebody having it locally. So yeah, it's scary, but it's also fairly rare, and we're just watching it very closely.
So Governor Charlie Baker announced this past week of a 4-phase opening plan.
Yes.
And I believe it's supposed to start Monday. Have you go ahead.
So there does seem to be a lot of confusion on what's going to happen on Monday. Here's what I can tell you that I believe is going to happen. On Monday, we are going to be told what that plan actually is. So on Monday, the current stay-at-home order is still in effect. On Monday, things don't open up. On Monday, we will find out from the governor what we're going to be able to open, and we're also going to be told how the enforcement of this plan will take place. It will be a multifaceted approach. It will be data-driven, and there is a possibility, depending on how we respond as a state, whether we go back to a full stay-at-home order or we are able to progress to the next phase. So if people I can't even tell what people should be doing yet because I just don't know. The only thing I got one little piece of information on is that the public gathering size will remain at 10. That will not be expanding. And we'll find out on Monday if that is completely accurate. So I felt pretty confident in where I heard it from that number will not change initially. That's going to stay the same.
I thought you'd have more information for me than that because you know, like inside scoop sort of thing.
Well,
I'm kidding, Jim.
The governor's being pretty close to the vest on what he's going to release, and many of us just don't quite know yet. And it's like this big giant Christmas present we're all waiting to open on Monday morning. And I hope we know earlier in the day and not later. And by no means am I going to wish anybody's weekend away, but we all want to get there and find out what actually is going to be, how this is going to play out.
No doubt. Other states are doing some phasing in, and yeah, I think everyone's just waiting to hear. I know a lot of businesses are sort of up in the air right now. So speaking of, the health department, it's not just all COVID-19. You guys are actually still up and running virtually, correct?
So the health department is doing nearly every single job we always have done, whether it be the food inspections, the nuisance complaints, the septic systems, wells, any of the jobs that you would need the health department to do, including the nursing jobs, are still being done. We're not in the office because the building is closed. And when the building will open, and I don't know that, that's actually being ironed out right now. So when town hall will actually reopen, we'll be able to let you know as soon as we can. You can still call us. You can still get us through email. And if there's a job that you need us to look at, or if there is a situation you need advice on, whether we're working remotely or not, we're still available.
That's good to know. So anything else, Jeff, you'd like to leave us with?
A couple of things real quickly. For a lot of businesses, there's going to be some changes, obviously. But there's going to be one change that's been in the works for an awful long time, and it is the new tobacco law that's going to be taking effect on June 1st. On June 1st, all 21 establishments that are in Westford, if they're actually 21 open right now, I think we've had a couple closed due to COVID-19, are going to have some pretty drastic changes in what they can sell for tobacco. So flavors are going to be basically removed from their ability to sell. And the characterization of flavor has changed in the state. It's no longer the fruity flavors of the vape devices. It also now includes menthol, mint, wintergreen, and all different types of tobacco, whether it be chewing tobacco, cigarettes, cigars. So they're going to be, for those establishments, a pretty drastic change in what they're going to be able to do. And some of the tobacco shops may have a little more latitude, but it's going to be a big change, and it's a state change. It is not a local change. So this is a state law. The other thing I wanted to make mention of is I know that there's a lot of people out there who are very frustrated. They're somewhat hurting because they are either socially distanced from too many people. And there's some groups out there that can really help them out. And when you start thinking about the mental health aspect of what COVID has done to a lot of people, there is an awful lot of help out there. We've got a lot of information on our website, but there's also some groups in town. There's one called SANS, See a New Sun. And it's a group that's been doing a lot of work, especially around the suicide effort to try to prevent it. And they've come up with some of these great little bags that they are giving to people that are filled with a lot of good information. Stuff like bracelets, pens with information, resource cards, notepads if you just need to write things down, and just some basic information to help you get in touch with people and to help you maybe just get through another day. And I'm really hoping that if people need help, they can find it. If anybody is looking for ways to get some of that information out, the health department certainly can help. Nancy Cook in town has been actually spearheading a huge portion of this operation, if not all of it. And I'm just looking to help support what she's doing, mainly because it's such an important cause.
Yeah, See a New Sun and Team Forever Young,
Yes.
I believe, came together this past year, and that Tim Whitcomb's part of it as well, isn't he?
Yes, he is.
Okay, great. That's some good information. So they can give you a call if they want to get in touch with someone from SANS.
If there is not a way, if they're just looking for a number to call and they're looking for some way to get information, we can at the very least get them to things like the interface number, which we have on our website, to number for SANS. On this card, there's just really good stuff like the National Suicide Prevention Lifeline, Call to Talk, Advocates, the NAMI group. There's resources out there for people to use, and there's help if people need it. And sometimes it's hard to get to that, but if you're willing to make a phone call, maybe there's help for you that we can at least point you in the right direction.
Yeah, that's really good information because it really is a trying time for all of us. And I'm just looking to get over on the other side real soon.
Oh, I think we all are. But you know what? Everybody in town, I think, is doing a great job. Everybody's working as hard as they can. Everybody knows how frustrated this is. If everybody just keeps pushing forward, following the rules, and just using good common sense, we'll finally get through this. I mean, we're finally at the point where we're going to have a new or new guidance on when things are going to open. Back on March 23rd, this day seemed pretty far away. And if you asked me back in March if we were going to be where we're at now, I would have said, no, it should be over by then. Well, now when I sit here and look at it, well, we don't know when it's going to end. And I don't think anybody can predict when this will be completed. And that's what the tough thing is. And I think we all have to just understand that, hey, this is a different time for us. And we need to continue to adjust and keep moving forward. And talk to our friends, make sure you're reaching out to your family members, and make sure that you're doing things safely. And let's just try not to overwhelm our healthcare system. But at the same time, everybody gets it. Everybody wants to get back to work. I mean, everybody working on this response fully understands what is happening to people and what's going on. So it's tough for everyone, and I'm proud of all of our residents for doing all that they can to try to get through.
Sound advice, Jeff. Thanks a lot for joining me today. We'll check in again next week.
Sounds good. Sounds
Okay.
good.
Okay,
And
great.
next week, maybe we'll have some guidance on what we can be helping people through.
Yep, we'll all be tuned in to Governor Baker on Monday morning, and we can chat about it next week.
All right, Patty. Thank you very much.
Yep, take care, Jeff. For WestfordCAT, I'm Patty Stalker.